Hi, Dr. Reagan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
If I was coming right out of dental school, I would first of all spend my marketing money on getting the education. We talk about that a lot. At PDA, we recommend an 8% marketing budget. We've talked about net zero marketing on previous podcasts, but my gut feel is when you're coming out of school, commit those dollars to education. Commit those dollars not to necessarily new patient flow.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hi, everybody. Dr. Bruce B. Baird here, your host of the Productive Dentist Podcast. We are looking at a question that I just got in a couple weeks ago. What should be my first step in marketing? And another great question. I mean, I get these questions on an ongoing basis. Everybody wants to know, okay, I've made the decision to market, and everyone's in a different position. Everyone's in a different place. So when I say, where should I start marketing? It depends, first of all, where you're at. If you're coming right out of dental school, that's a different answer than somebody who is, say, 40 years old. I say 40. It could be somebody who's coming right out of dental school at 40, or somebody who's been in practice, I should say, for 20 to 25 years, who's been going to continuing ed, who's been going to the implant courses, the aesthetic courses, the reconstruction courses, the endo courses, on and on and on. So when you look at that, your marketing would be different. If I was coming right out of dental school, I would first of all spend my marketing money on getting the education. We talk about that a lot. At PDA, we recommend an 8% marketing budget. We've talked about net zero marketing on previous podcasts, but my gut feel is when you're coming out of school, commit those dollars to education. Commit those dollars not to necessarily new patient flow. I'm okay with you signing up for some PPOs and have them, that they're basically a marketing company anyway. They're not insurance. I don't want you to think PPOs are insurance. PPOs are marketing companies. You sign up, they do the marketing to their people. People come to you. You're doing dentistry at a much lower cost. You're doing crowns for $500, $600, $700 instead of $1,400. And so if I'm a young dentist, I'm looking at it, okay, sign up for those, but get your education. I would do that for 3 to 5 years. And at the end of that 5-year period, I would begin to systematically wean myself of all the PPOs. Now, I'm telling you, you've spent 8%. You've spent some of that money on coaching, hopefully, but you've also spent some of that money going to COIS, going to SPEAR, going to the courses around the country that are going to give you the expertise clinically to look in the mouth different than you do today. And so it's really critical to do that when you're first starting out. Now, Once you've done that, you wean yourself off of the PPOs, and then you begin spending that 8% on the coaching and the marketing instead of on the education. Now, you're going to continue to do the education, but what you're going to find is you're going to be so much more profitable at that point when you're ready. That won't be an issue. So that's important. Now, what about mid-career? What about the mid-career dentist who comes to me and now they've had PPOs, and we're going to talk about how to systematically eliminate it. I know that our buddy Chad Johnson and Reagan have got the Everyday podcast. They've talked about getting rid of the PPOs. There is a systematic way of doing that. But I would begin, if you're already in that situation where you've got 10, 15 PPOs, first of all, your profitability is nowhere close where it could be. And so the strategy now, you've been to education, you've gotten your training, and you've gone to these different courses. To me, oh gosh, what a mess, because now you've gotten so much knowledge, so much information, yet you're getting patients that are just thrown to you from a PPO. Most of these don't need a lot of dentistry. Most of them don't have much that they need except cleanings and, a few fillings here and there. And that has defined your practice in this first 5 to 10 years. Well, now it's time to change. Now it's time. That's what PDA does. We teach doctors to communicate at a different level, to get patients to say yes to treatment, no matter whether it's a $1,000 treatment plan or a $20,000 treatment plan. How does that work? Are all the patients you see from a PPO, are they going to be $20,000 treatment plans? I would say on average, most PPO plans are sending you just families, new patients, working age people who have gotten the PPO. And you've gotten the knowledge to do full mouth rehab. You've got the knowledge to do implants. You've got the knowledge to do all-on-4. You've got the knowledge to do aesthetics, veneers, changing people's lives with their smiles, all of these things. But yet the patient flow that you have is not the kind of patient flow that you want. You don't want mass numbers of new patients coming from a PPO. And we've had docs that have 100, 150, 200 that are coming in. That is a disaster for your dental practice. Now it was necessary when you first started because you had bills. You had all this stuff you had to pay, but you didn't have necessarily the knowledge to give comprehensive treatment plans. So that's why I say early on, go get that knowledge. You're not getting it in dental school. I can promise you, there's not a dental school in the country that teaches at a level that you want to be at. And if the dental schools are the level that you want to be at, sign up for the PPOs and just do that the rest of your career. I've seen guys that have been successful at it. But if you want to help patients at a different level, you need to market at a different level. When I say marketing, all of a sudden you're beginning to market to the procedures that are specific to the things that you enjoy doing. And I can really say that works very well, even for as you go in your career, that's going to narrow down. You're going to find the things that you really love doing. Now you're maybe mid to late career. What are the things you really love to do? Because you know what? If you really love doing endo, you're going to market to pain patients. You're going to market to that. I hate endo. You guys know that. And I would find a great referring doc right down the street or bring somebody in that could do it for me because I don't like doing it. And you know what? I don't have to. As I get into the mid to late career, I only want to do the stuff that I love doing. I've been able to, and most of those higher end procedures are more profitable. So you go through this deal where you struggle early on, but use that struggle to get the education. You then get into your mid-career, start getting rid of any PPOs that you have, because that's going to make your increase in profitability. And continue your educational journey, continue to go to courses. And then you get into this mid to late career. And at that point, it's extremely targeted marketing. If you love to do laser, LANAP surgery, laser periodontal surgery, then you can refer specific to that. if you want to do specifically that. What if you say, well, I really enjoy doing a little bit of everything? That was me. I enjoy doing a little bit of everything. I don't want to really target just implants. I don't want to target just veneers. I really want to target people who need dentistry at a higher level. We call that train wrecks. And I've had podcasts on the train wreck marketing that I like to do. Why? Because I have the education to do it. Now, what if you haven't gotten through all that education? Well, it's really hard to market to train wrecks if your skill level is, not at that level. And there's that's not saying anything negative about you individually. It's just saying you're on a journey. You're on an educational journey. I always used to tell people, my commitment to myself was every single year, I want to be a better dentist than I was the year before. Meaning I'm going to go to courses. I still go to courses, and I put the handpiece up. I still work with dentists all over the country, and they ask me these questions. So I want to stay up on the latest technology. I'm doing some things with printing and, print technology and all the new scanning technologies and the milling technology. I mean, there's so many cool things happening. But until you commit to something like that, it's not just going to happen by osmosis. So in the mid to later career dentist, you're going to really specifically market to what it is that you want to do. Now, what if you get to that point in your career and you're like, I like doing everything. I like doing everything. Fine. Then you're marketing more towards the dental new patient that needs dentistry across the board. Now, is that patient going to be a 27-year-old worker at the chip plant down the street? Probably not. Is it going to be the 55-year-old? No, there's the age of the patient's going to change. That if you love doing all kinds of dentistry, then don't market to the family. Don't market to the 3 kids. Now, if you love doing kids and you want to have a family practice, they can be extremely successful. If you love working on kids and doing all that. Now, what you'll do is you'll market to a different segment of the population. You're going to be marketing as, to different, not only different demographics, different locations, different areas. And that's going to make all the difference in the world for you doing the things that you want to do. Because most importantly to me, if you're in this dentistry realm and you're working hard and you love doing the dentistry, find out what increases your joy, what increases your fun at the office. And we can go into that a lot. I mean, teams and all of these things can affect how you feel about your practice, but we're going to be going through a lot of that over the next 20 to 30 podcasts. But it's going to be super important. Where do I market? How do I market? How much do I market? All of those things we work with you on at the Productive Dentist Academy. So if you want to learn, what authentic marketing is, I challenge you to come to the course, sign up. And I think it'll be something that you'll listen to and you're going to say, wow, I hate to spend this much money to go to a course, but you know what? You're going to be doing that the rest of your career. I would prefer you to come and learn how to communicate the skills and how to talk to the patients and how to market properly so that you can begin this journey of increased job satisfaction, increased joy in practice, increased joy working with your teams, because the practices that are most successful that we work with on an ongoing basis are ones that are great communicators. They've learned to market to the things that they love to market, and they're enjoying dentistry. They're enjoying life. Very different group now. The younger dentists are very different than the old baby boomers. The baby boomers would work an extra, they'd work 60, 70 hours a week and find out why am I not so happy in my family. The young dentists kind of have so much fun stuff that they're doing. How do I focus on my business? So these are the things that I hope you'll gather from these podcasts. And I look forward to seeing you at a Productive Dentist meeting in the future. We've got so many new things that we're doing. So look forward to seeing you. Thanks.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.